So there's a question from yesterday that we think definitely deserves more time. It was about who to listen to when it comes to coronavirus. Vice President Pence has encouraged the idea that new COVID-19 outbreaks are a result of a rise in testing. But experts do not agree. So Dr. Kohli joins us live. Thank you for joining us, Doctor. We want to know, what are the facts? Break it down for us, Doc.
So, Sam, I'm glad you asked, because I think it's really important to go over the facts. So let's break them down. Fact number one, yes, part of the rise in cases is due to increased testing, but that's just a very small part of what's explaining the rise in cases. Fact number two, Oklahoma, which is going to be the site of President Trump's rally on Saturday, has actually decreased their number of testing, yet they're seeing an increase in cases. So how would you explain that if it was all due to increased testing? Fact number three, we're seeing an increase in hospitalizations occur across many states. And hospitalizations, as we've talked about before, is a metric that's independent of how much testing you're doing. Because if you're sick enough to go to the hospital, it doesn't matter whether you got a test or not, you're going to show up in the hospital. So the fact that hospitalizations are going up, ICU bed utilization is going up, shows that the disease activity is going up. And fact number four, in the long term, if you think about it, take a step back and think about why we're doing testing. The goal of testing is actually to decrease the number of cases, to reduce the spread of the disease. So the more people we test, the more that test positive can be isolated, and we can actually reduce the spread of the disease. So it's a little bit counterintuitive, but testing is actually meant to reduce the number of cases. So when you hear people saying that testing is the explanation for the increased number of cases, it's just not true.
Hey, Doc. Well, this is Al here. I have a question. First of all, long time no see. Good to see you.
Hi, Al. Good to see you.
All right. I have a question on behalf of myself and all our viewers. Like, how do we know who to trust?
Yeah, this is a great question. So I will say one thing, trust the science. The science never lies. The science does not have a political agenda. And Dr. Fauci said in just an interview yesterday, there seems to be really an anti-science bias or anti-science rhetoric in our community. And you know, I think I get where that comes from, because the science roller coaster has been going up and down during this pandemic. First we said masks don't work, then we said they do work. We said hydroxychloroquine, you know, does work. Now we're saying it doesn't. But that's just because we're getting new facts. So the science is not misleading you. You just have to trust that your science is your true north. And if you listen to the science, you can't go wrong.
Great. No, I think that's hey, if I'm going to go talk to Mike Pence, and I said this yesterday, about government issues, then yeah, we can have a conversation, because he's an expert in that sense, depending on what side of the aisle you lean. But when it comes to medical advice, why it's mind-blowing to me that we don't listen to our medical professionals and our scientists. It's just, I can't wrap my head around it. Before we go, it's time for Dr. Kohli's silver lining. Dr. Kohli, we need it now more than ever. What do you have for us today?
Al, are you going to do your voice? Or?
Silver linings, y'all.
Thank you. So I really need it too this week, you guys. And I want to emphasize it's not all doom and gloom out there. There is some good news. So just this week, we got a new study that was actually showing promise for steroids, which is a class of drugs that we've had around forever, in saving lives. So this is the first drug that's actually shown to prevent people from dying from COVID infection. In fact, the trial was stopped early because it showed so much benefit. So they think that the drug, you know, is going to work so well. And it's already available. It's something we've had around for decades. And so as soon as this data gets published, we will have our first therapy for COVID that actually saves lives.
Yes, that is the best silver lining.
That's a super silver lining.
That just gave me like a big sigh of relief. Thank you so much for that. That is hope. Wonderful news. Thank you, Doctor.